I wanted to present some information on what our teams did. And this is what you're seeing here is a screenshot of a toolkit that we created to summarize what the provider pilots that we worked with did to try to implement choosing wisely. And you can see the resource, the link to that. If you just click on that, you'll go to our website and you can download the document itself. Go ahead, just to show some of the parts of this. One is to map out some workflows. So again, great idea, but what do? You just talk to providers, you throw some, information in the waiting room. What really happens? And I think the pilot practices that were most successful really mapped out an effective workflow, starting with the front office staff. Now, might work in some practices, not in others, but the ones that did our pilots tried this out and I think found it to be successful. So starting with the front office check-in, a patient would receive a wallet card with the 5 questions, and depending on what their complaint was, if there was a patient information sheet, again, for our focus areas, and because those areas, low back pain, antibiotic for sinusitis, I think the cardiac ones turned out to be less so because clearly that's not so much presenting in primary care, but chronic pain, the front office staff would give the information to the patient ahead of the visit to really prime them in that thinking. I also forgot to mention the 5 questions, so I apologize. But in addition to all those condition-specific patient info sheets and recommendations, ABIM also came up with a set of 5 questions that they encourage everybody to ask about the healthcare test and treatments that are being recommended. So number 1, do I really need this test or treatment? Number 2 is, are there other options available? Number 3, what are the side effects? 4, what happens if I do nothing? And 5, the ones that providers hate, how much does it cost, right? Hate it because most of them aren't prepared to answer that question. So that's sort of an overall sort of cultural approach to, geez, you can ask questions, and a lot of discussions in those practices, a lot of feedback from patients saying things like, I can ask that? And the classic one is my 85-year-old mother, right? When I talked to her about this, what? Is that okay? Isn't the doctor going to be mad at me? So a lot of discussion about the need to both encourage people to ask. Patients will say that you've given me permission to ask, and then also a lot of work, I think, to prepare providers to be receptive to those questions. Right? They're not necessarily used to those questions. They may not want those questions. So preparing a fallow ground, we talk about it from the provider side as well as encouraging patients to ask. And you can see here that process flow continuing on through the patient visit. So ideally, having information available like educational videos, I'll show you some of those, or patient info sheets in the waiting room, in the exam room, clinical staff checking in to ask patients if they've had a chance to look at it, if they have questions, addressing those questions in the course of the visit, and ideally referring patients to more information, whether it's videos, other practices, you'll see here in a minute. The specific examples of scripting. So a little bit hard to see here, but as part of that workbook, you can see if you click on it, download, keep going, and here, next slide shows a little bit blown up. So just showing an example. So again, to the extent that providers aren't necessarily used to the process of people asking questions, right? So I see you have some questions with you. What's most important to address? We might not be able to get everything, and it just walks through. And a lot of this is pretty basic for people who've been working with practices, but getting down to some of the maybe stickier questions about cost, some suggested scripts. Also, go ahead. The ABIMF has these communication modules, so they've got short videos that show a scripted interaction between patients, and okay, if a patient says this, what could I say as a provider? They're all somewhere in the order of 2 or 3 minutes, so to the extent it could be helpful to providers, I think another useful tool. One of our practices sum this up as 3 easy things a practice can do, putting the information out there. So you can see a picture, they constructed a bulletin board or a rack a bulletin board actually explaining choosing wisely and encouraging patients to ask questions, particularly the 5, putting file folders in the exam room, and educating staff through a variety of ways. And we know, right, in any kind of practice change, it doesn't work to just do it once, and it doesn't work to just do it with the providers. So having it as a standing agenda item, bringing it up repeatedly, and making sure that folks all the way through the front office staff understand what this is, why we're doing it, where they could go with questions.